All right, what you see Anita here performing is something called blood flow restriction, or BFR training. As of 2018, the American Physical Therapy Association has now promoted BFR training to be the premier training tool to use when rehabbing from either a lower leg injury or an upper body injury. What BFR training does is it takes all the science that we understand about how muscles work underneath weight and allows us to now more intricately establish an environment inside of your leg or your arm that mimics if you were lifting heavy weight. So how BFR works is this unit here is a pneumatic machine. That means it's not any different than your blood pressure cuff that you'd be using at a store or at home. But this special unit is going to maintain pressure and also count out reps and do a couple other neat things that allows for Anita to take what would be an otherwise simple exercise and really feel like it's a much more difficult exercise. Now, that's beneficial because as the oxygen is running down through here and maintaining pressure in the tourniquet, it's beginning to mimic an environment in her leg as if she was lifting heavier weight. Now, let's say Anita was recovering from a knee injury or a surgery. It might not be optimal and it may not be safe at all for her to be lifting heavy weight. So this gives us an opportunity to still maintain muscle strength gains and muscle size gains with less weight involved. Now, there's some other benefits that can come from blood flow restriction training in that it does promote positive adaptations to the cardiovascular system, but it can also aid in quickening the pace of recovering after a fracture or even a ligament or tendon repair-based injury.